Hi, it's Sarah from Thriving Solo here. And running a solo practice is amazing. You get into work with people that you can actually help. But let's be honest, the admin side can sometimes feel like you're trying to juggle with both hands tied behind your back. There's the scheduling, the billing, paperwork, and sometimes that all can get just a little bit much. That's why today I'm sharing the 5 must-have tools for running a stress-free solo health practice. These are the ones that I added and used to keep my clinic running smoothly without drowning in admin. It doesn't have to be complicated tech or you have to have a huge budget, just a handful of smart, simple tools that free you up to focus on your clients and maybe even give you your evenings back. So let's start with the tool that saved me the most time every single week, and that was an online booking and scheduling app. So you just need a simple online booking and scheduling tool. A good app will let clients book for themselves. It will let them reschedule and it will give them reminders without you actually having to lift a finger. All you need to do is set your hours in there in the first place, and your clients can actually book into those hours. You do have to remember that if you want to take some time off, you actually book that out. It doesn't appear as bookable hours in the calendar. But a good booking app will let clients actually add themselves to a waiting list. If you're too far booked up in advance, you can usually set it to let them know, how far in advance they can book up. And it means that a good one will also send out reminders of when their appointment is. And we'll talk a little bit later about how you can link that so that it reduces the cancellations that you get, or at least it reduces the last minute cancellations that you get, which is something that costs an awful lot of time and money to manage potentially. So the other thing that it helps with is it can reduce phone tag. If you're having to take all bookings by telephone, then you tend to have to be available a whole lot more. And if you're in with clients, then the usual thing is that you get off an appointment with a client and you find out somebody's been trying to contact you to reschedule their appointment. An online system lets them go ahead and change that themselves. So that's something that I really benefited from. I started off with a very simple system, a free system as it was at the time. I'm not sure whether it is now, but I started with a system called Fresher, and then I upgraded over time to a system called Jane. Now, Jane is more than a booking and scheduling system, but it does that as well. So that was really helpful to me. So booking is great, but what about everything else, like the notes that you need to keep? And if you're in a professional regulatory body, then you'll need to keep specific notes usually. So that's where a lightweight practice management system can come in. So that's the number 2 tool, a lightweight practice management app. This keeps everything in place in one single point. So you've got the bookings and you've also got their actual client notes. With certain systems, you can have very visual notes as well as written notes. So you can have, if you like, a map of the body and be able to circle which are the areas where we've got conditions that we're trying to treat. A good practice management app will handle, as I say, the bookings, payments, reminders, and it will also manage securely the electronic healthcare records. And this is something that you do need to be especially careful of. In the UK, we have data protection, and there's specific rules that are in place over health records, records that include sensitive data, which health records do. In the US, I believe it's the HIPAA Act that governs this. And so whatever practice management system you're using, you do need to make sure that it meets the regulatory requirements for secure recording and storage. The Jane system, as I said, that I used, did do that, and that was one of the reasons that I went for it in the first place, because it was something that met those secure storage requirements. It meant that I could keep my clients' notes on the system. It meant that I could, if they wished to, share those notes with them securely. And it gave me a space to be able to write up how their treatment was going, what outcomes they were looking for. Everything was contained in a central area, which was really helpful to me. If somebody called me up, I just needed to look up their client record, and I wasn't scrambling for paper notes. Where did I file that, etc. It was there very, very smoothly. Of course, seeing clients is one thing, actually getting paid is another. So let's talk about how we can make payments and billing less stressful. And that's with some sort of system, again, for invoicing and taking payment. Now, I would say that while this is something that is very important to us as practitioners, it's equally important to our clients. You want to find a system that is easy for them to use and that is reliable enough for them to trust in. Now, my clientele were elderly people, and a lot of them did not trust using digital systems for payment. So I still needed to be able to, when I say they didn't trust digital systems, they weren't comfortable with using my Jane system to actually input their payment details. I had some clients that were perfectly happy, and it meant when they booked, they actually paid at the same time as they were booking, and it was all done in one. That was fabulous for me. Took away so much time and stress. But like I say, others weren't so comfortable with that, and they were happy to bring a payment card, and I used a system called SumUp and Stripe for them to be able to just tap their card. Very occasionally I had people that still wanted to pay by cash. That then is some extra work, but I would say that you want an invoicing tool. As I say, I use Stripe in conjunction with SumUp, and that allowed me to, if they wanted, send them a copy of the invoice and the receipt. It gave them a receipt for if they were making a claim for their healthcare. It meant that it was in my system, and it was tracked. I could see exactly who had paid. So it also reduces the difficulty, the awkward conversation in getting paid. So I would just ask, how would you like to pay today? Is that card or cash? So that makes things a lot simpler and takes away a lot of that awkwardness. Now, if you really want your admin load to shrink, automation is going to be your best friend. And there's a number of little automation helpers that I worked into my systems, and I used various reminders, forms, and odd little automations along the way to save hours every week. So some of the sort of automation helpers, we've already talked about the booking systems that can send out reminders for you, so you're not even having to touch that. That is something that saves so much time in a week. But you can also set up pre-made templates for your patient intake forms. That was something that I did very early on. You can set up forms for aftercare. So I had a regular template that I'd made for aftercare, and I would just pick one of a couple of different templates that was appropriate to the person that I was seeing, print that out, give it to them, or email it to them if they were happy with that. The great thing about that is that it makes you look so professional. You know, have this system in place. It helps the client to be able to build that trust with you. They feel cared for, and it cuts down so much time as well with them phoning up to check things later on. Templates usually mean that there's less chance for typos in there. If you do spot a typo, obviously you change your template, but once it's changed once, you're not needing to keep changing it every time. Like I said, automated reminders actually cut down the number of cancellations or late cancellations that you get, because people have had a reminder and think, oh yes, I need to attend that. Like I said, a lot of practice management tools can bundle that in, but templates are probably something that you will still need to set up and can add to a practice management system. I created various templates, like I said, my intake forms, and added them to the Jane system. Finally, not all tools are digital. There's also space for having some physical upgrades in your clinic that can make your days a lot smoother. So physical helpers include things like an ergonomic chair. If you're going to be sat in your chair to do intake, to chat with clients while they're there, etc., you want a chair that is going to be comfortable, that is going to support you, that ends up creating less back strain for you. Similarly, a reliable treatment table. When I very first started my clinic, I just had a mobile table, one that I could take out and about, because it was what I'd used for learning my massage skills. But then I switched to get a hydraulic table that was better for my back, and it was also safer for clients. I could lower that table for them to get onto it in a safer fashion, and then raise it up to be the height that I needed for doing the treatment. Another little physical helper that I would suggest, depending on your particular health practice, is a heat lamp. A heat lamp was something that I could use, and it not only provided additional comfort to the client and a little bit of extra comfort in terms of warmth in the winter months, it was also something that meant that I didn't necessarily have to spend quite as much physical exertion on a client with extra things like massage. A final little physical helper, but something that again can save an awful lot of time, is label makers and appropriate storage. So if you've got, your tools of the trade, whether that's needles, whether it's massage oil, etc., if you keep them in appropriate storage, well labelled, it helps you spot very quickly when supplies are getting low, so that you can restock and not run out. So those little upgrades can help a lot along the way, as well as the digital items that I'd suggested. So these are some of the best tools for a solo health practice. If you want to have a bit more headspace to be able to focus on your clients and less worry about admin, I would suggest starting with just one change at a time. You don't have to put everything in to start with. And Go for what is affordable for you long term, or even affordable short term, with a view to perhaps upgrading in the future. Even if you only adopt 2 or 3 of the items out of this list, you will find that it can cut hours of admin every week. You don't have to do it all alone. If you've got any questions, please do drop them in the comments below, and I will try and answer your questions as best I can. Thanks for stopping by.